welcome to everyone who's in the room and to everyone who's joining online for this seminar today on learning from grassroots responses to COVID-19 in Brazil, Canada, South Africa, and England, of course. We've had a slight change to the program, so I'd like to welcome the speakers who are joining here today and online. We will have, instead of Suzanne Sikia, we'll have David Roberts, who is Professor of Urban Studies at the University of Toronto. We will have Vera Coelho from Sebrae in Brazil and the co-principal investigator for the Building Back Better from Below project. Principal investigator Alex Shanklin from the Institute of Development Studies. Lauren Andrus, who is the principal investigator for a sister project to the Building Back Better from Below, Panex-Youth, together with her colleagues at the University of Birmingham, and Luciano Bizotto from the University of São Paulo, USP. Last but not least, we're happy to welcome Fábio Vera Soares, who's the International Director at IPEA in Brazil, and the coordinator of the T20 Policy Research Stream of Brazil's presidency of the G20. So welcome, everyone. We're looking forward to a really interesting seminar. Just a little bit of housekeeping for those of you who aren't familiar. We'll take the first hour to hear the presenters, and then we'll have, 50 minutes, I should say. Then we'll have 10 minutes for Q&A, a round of Q&A. Some people might have to leave at 2 o'clock, so we'll take a very brief break so people can leave then, and then we'll continue with half an hour of discussion and questions and answers. Right, so a lot of you will be familiar with the work we're doing here because IDS is hosting the Building Back Better from Below conference this week here. We've got colleagues joining from Brazil and from Canada. Forgive me, Zoom has decided it wants to do an update. This seminar here focuses on sharing some of the insights that have come from the research on this project. And we are looking at innovative responses that emerged during the pandemic and in the post-pandemic in response to access to food and healthcare, and also issues of voice and representation in the cities of Toronto in Canada, São Paulo in Brazil, and Brighton and Hove here. Both the Building Back Better from Below project and Panex-Youth focus on initiatives that were led by marginalized and racialized communities and frontline service providers who are working across these themes of food provision, healthcare, and in the case of Panex-Youth, access to education, play, and leisure space, as well as accompanying the struggles for voice and representation of young people and minoritized groups in the wake of COVID-19 and the Black Lives Matter protests. Really looking forward to hearing everyone, and I will pass the microphone on to Alex.
Brilliant.
So we have 10 minutes each, please.
Oh, okay. Wow. Okay, fantastic. Thank you so much, Jenny. And I also just wanted to express a particular thanks, Jenny, for making possible the meeting with the Transatlantic Platform V4, Building Back Better from Below project here at the Institute of Development Studies. And it's also very fortunate that Jenny's also working closely with Professor Lauren Andrus' team on how we move on from here and further collaboration. Within the ambit of this innovative and important social science research collaboration funded by the research councils of the countries involved. So in our case, this is funded by Prepare in Brazil, by the Economic and Social Research Council in the UK, and by SHRC, Social Science and Humanities Research Council of Canada. South Africans also have their own funding from NRF and also for PSP, ESRC. So the core theme that we're interested in is learning together across North and South and across the two sides of the Atlantic. And I think we've already had some really rich discussions here in IDS with our partners in the V4 project. And also we know at the same time, because we can see them, those of you who are on Zoom can see them online, at the University of Birmingham hosting the Panex-Youth partners from England, Brazil, and South Africa for a similar session of sense making across these very different settings, but around common challenges. So to focus specifically on V4 very quickly, so we're working here in Brighton and Hove, working very closely with Bridging Change. So we have the co-directors of Bridging Change, Nora and Sri here in the room with us, which is fantastic, and Brighton and Hove Free Partnership. We also have Vanessa from Brighton and Hove Free Partnership here with us in the room. We're also working with NHS Sussex and with Brighton and Hove City Council, and we're really pleased to have some colleagues from the council here with us today. So this is very much an engaged action research partnership, starting with the lived experience and situated knowledges of people who are actually delivering innovative responses to racialized injustices in the fields of food, health, and representation across the city. I'm working in Sao Paulo, Professor Vera Tatan's research team based at Sebrae, but with many colleagues from FGD, and also working very closely with partners, including the movement of homeless workers. So we're pleased to have Juliana Bruno from MPST here with us. And we have partners from the University of Toronto. David will speak to their collaborations, but again, many of their key partners, such as Dr. Leland Gilbert-Michael is here with us. And so this has really been a really rich learning space across the academic, policy, and practitioner activist communities. So briefly, we're trying to document these innovative approaches, as Jenny has highlighted, because our approach is based on the understanding that it was the innovations and improvements of local communities and frontline services in the response of COVID-19 that shows what we should be drawing on. And of course, in the UK, this is particularly relevant because we're in a general election period, so there's a debate around what the direction for the country should be. We believe very strongly that whoever is in power should be informed by the lived experience, the knowledge, the innovations, and the rights claims of people who are on the front line, whether they're working in the health services and local government, in community groups, in the voluntary sector more broadly. And that there are very valuable lessons that haven't necessarily been learned yet, but that need to be drawn on to inform future policy, or the structural injustices that were intensified by the pandemic will not be shifted in the way they need to be shifted. So Brighton and Hove, very briefly, for those of you not familiar with the city, it was the site of some of the earliest diagnosed cases of COVID-19, so it was an early response center, and the response was seen as innovative, effective, joined up, all those things that a response should be. Those of us who lived in England during the pandemic will know it didn't necessarily stay that way. There was a heavy process of centralization of the COVID response, but we wanted to register the city that is home to us in the Institute and to many of us in the team, was an early responder, and that some of those joined up ways of working, as we'll discuss briefly here, and as colleagues can speak to when we get into the discussion, persisted during the pandemic response. Just in terms of racialized injustice in Brighton and Hove, it's worth registering that even though over a quarter of the population is registered as Black, Asian, minoritized ethnic, but that includes minoritized white ethnicities, such as Irish travellers and other marginalized groups who don't identify as Black. Even though we have a substantial population of minoritized communities, the visibility in local politics is not as significant as it is, for example, in Sao Paulo or Toronto, and some of the discussions we've been having is around how that might change. So Brighton and Hove famously has a very high visibility presence of the LGBTQIA+ population, with real active participation in shaping policies in the city, and that's been less so for racially minoritized groups. We wanted to register also that our case studies don't just begin with the start of the COVID-19 pandemic and the first lockdowns in March 2020, they begin also with Black Lives Matter 3 months later, when the protests hit the UK at scale, and this was a wake-up call and a shock to which health system managers, local government people, and community groups were all responding. So I'm not going to go through the detail, but the crucial takeaway for the health emergency response is that even though there was, in principle, a commitment to joined up service delivery, it wasn't real until the pandemic forced people to make it real. And then we had some really interesting experience of effective, rapid, decentralized decision-making, which included a lot of flexibility around how resources were allocated and how roles were performed, people being less stuck in predefined silos. So we found this to be a way of working that was effective, that was experienced by managers at the front line as enabling and as empowering, despite the incredibly difficult, often traumatic circumstances they're working under. And we think that at the moment we're discussing the future of the National Health Service in the UK, it needs to be registered that joined up local decision making, bringing municipalities and local health system managers together really worked, and we need to learn from that. Particularly because the City Council had been shocked by Black Lives Matter into registering the need to declare itself and to act upon being an anti-racist city, which hadn't happened before, at the same time as the NHS was shocked by the data on racial health inequities into taking action within the health system, but also in relation to the Black and minoritized health workforce, who were also much more exposed to COVID and experiencing much higher levels of morbidity and mortality, and the injustice being called out in that area as well. Just to register also, there was a lot of rapid digital innovation experienced unequally and sometimes problematically, but that's something that stayed with us, and we think we can look at the more inclusive digital innovations as something to draw on. So our colleague Erica Nelson is leading a study with is Neil from here? So we have Neil Singh from Sussex Medical School, who's also led one of the really innovative initiatives that's one of our case studies. But essentially, one of the interviewees in this work said, this is when the world changed. We realized from the data, we realized from Black Lives Matter that business as usual was not enough, that racial injustice and health had to be tackled. So there was a series of initiatives. What the one we're looking at particularly is a one called PCN level, which is primary care networks. This is below the city level, but it's about decentralizing funding and resources to engage in a new way with communities and to make visible the racial dimension of racial inequities through new approaches to data and new approaches to outreach. We also are looking at a series of cases around food response. So we want to register the Brighton Hove Food Partnership, which Vanessa represents here. It's, if you like, the holder of an institutional memory of a long-standing collaboration across the local municipality and the voluntary sector, and that provided an important resource on which to build in the pandemic response. So a food cell was set up, which brought together people from the council and from the voluntary sector who already had worked together across city food initiatives, and that was really important. But also there was a series of efforts to target support towards minoritized and racialized communities. So a lot of groups who had worked previously in other areas but not on food pivoted to providing food support. So that includes BMACP, which has also been an important interlocutor of the project, which is Black and Minoritized Ethnic Community Partnership. Then we have a series of innovative local initiatives that we've documented in case studies, which we can speak about, and the people responsible for them can speak about when we get into discussion. So this sense of crisis unlocking innovation was very present in the food sector. But of course, we also then went into the food price shock and food actually becoming less available, not only for racialized and minoritized communities, but also for the low-income population in general. So the action learning set with affordable food projects that the British Brighton Hove Food Partnership hosted with the Ideas Research Team highlighted a set of challenges around what they call the triple crunch. So there's less surplus food around, food prices are higher, funding is being cut, and actually sourcing healthy, culturally appropriate and locally produced food is getting harder after the pandemic. So we have this paradox that the pandemic was seen as the crisis moment, but in terms of people experiencing food poverty and food insecurity, it was the post-pandemic moment that was more of a crisis. But because it wasn't recognized as such by government, the level of systemic support just wasn't there. So they've identified a series of ways forward, which hopefully we can get into in the discussion. I wanted to register also that Bridging Change, our partners here, led an action learning set known as Change Makers, with people who are at the front line trying to get more voice and representation for minoritized and racialized communities in the city. And there's a series of important learning from that around how groups work together better and are more effective in getting heard by the local municipality, but also by the health service. And so the process and industry from Bridging Change can also speak to that when we get into the discussion. But we also wanted to register there was a response, right? So both the NHS and the municipality tried to respond, and that included a series of initiatives, including, as I mentioned, declaring Brighton Hove an anti-racist city, setting up a civic leadership academy, setting up Black and racialized minority workers forum, mentoring schemes, and also, intriguingly, almost by accident, the visible representation of racialized minorities in local politics increased after the most recent local elections, because there was a swing to the Labour Party. The Labour Party has a long-standing policy of Black and minoritized candidates getting onto lists. So kind of almost by accident, we have a broader range of representation in formal local politics. And the question is then, so how does that connect with these grassroots initiatives led by marginalized racialized groups themselves? How is that connecting in politics in a way that can lead to lasting change? So I think that's it. I just wanted to, we have some key findings, which I think I'll share at the end. But the key questions that we're grappling with here, which I hope we can all tackle in the discussion, are around how do we institutionalize, how do we consolidate, how do we ensure this is not lost? There's a very widespread sense that some of the most powerful, promising innovations are draining away from lack of resources, from exhaustion, from an adverse political context, and we need to see how do we recover the energy, the creativity, but also the resources to ensure that these innovations can be sustained. Okay, and over to, I guess, Kieran, we need to go into the Canada presentation, the Toronto presentation. That's the one, that's it.
Perfect.
Right.
Okay, hello, again, I'm David from the University of Toronto. This work has been done by a very large team in the University of Toronto, including many colleagues who join us online and some that are in the room. So this slide is just acknowledging the work of those, and they span an interesting range from development studies to public health to urban studies. To those who are working on the front lines. So it's been a really collective initiative, but just really some quick context for those who might not be familiar with Toronto. So Toronto, until the 1990s, was 6 different municipalities, and then the federal government, the provincial government came in and decided to amalgamate us into one very large city. And this context, I think, is indicative of other sorts of unique elements of the Toronto case, in that cities in Canada are creatures of provinces, meaning that there are no constitutional authority or protection for the things that cities do. Anything that a city does, including initiatives around public health or the management of their electoral process, are governed by the province and can be changed by the province at any given time. One quick example of how that intersects with our project is that in the last city council election, which was in 2020, the election, we had a new set of wards. Essentially, the city had gone through a multi-year process deciding how to reconfigure the city council and redraw the wards, both to impact the sort of equal out representation across various different wards in terms of number of people, but also to allow for more diversity on the council. During that election, the province decided that was no good and reoriented the wards back to the old 25 that we had. So it went from 47 to 25 in the middle of the election at the whim of the province. And as a consequence, our city council is far less diverse, and each councillor represents 100,000 plus people, rather than a much more kind of grassroots, localized form of government. This is also a kind of quick snapshot of the city. Some of these stats are a few years old, just based on the census. But Toronto is the 4th largest city in North America. Up until the pandemic, it was the fastest growing city in North America, and we're probably getting close to that once again, mostly through immigration. So we like to call ourselves the most diverse city in the world in terms of where people come from. More than half of the people who live in the city of Toronto were born outside of the country, and as such, we have a very significant racialized population. We've talked a lot about terminology over the last couple of days. The Canadian Census uses a term called visible minority. Increasingly, more progressive communities, it's not fully undisputed, use the term BIPOC, which is Black, Indigenous, people of color, as a way of capturing that level of diversity. Toronto also has high rates of poverty in comparison to the province and to the country, and has a real affordability crisis that shapes housing, but also all kinds of other things. Yeah, so that's sort of the background that to get you a sense of what we're doing. The Toronto team has structured their approach to data collection around case studies, and increasingly around a network of case studies. So both the individual organizations as well as the relationships between those organizations and how they negotiate different dimensions of addressing the food and health insecurities that existed in Toronto prior to the pandemic, got exacerbated by the conditions of the pandemic, and then continue on apace, even as the pandemic has been declared over by some sectors of the world. The first organization that we spend a lot of time with is Taiwu. So we have Lehman here, who who's the director of Taibu, and their community health center, they have a commitment to Afrocentrism, Ubuntu, Nguzu Saba as their founding principles, and that is not just, I would say, given all the interviews we've done, we could confidently say that it's not just a rhetorical thing to be put as a slogan on the front of the building, but it really is deeply embedded into the decision-making that happens, the types of services they provide in the communities that they work in. Also, as a community health center, they are well established, have long ties and deep ties with both the local community in which they exist, which is in the northeast of the city of Toronto, as well as within Black communities more broadly across the city. And so we use the concept of collective impact in our theorizing, or at least we base some of our theorizing off of it. And one of the key elements of a collective impact approach or collective impact analysis is a strong backbone organization that is part of the network in which the collective impact is happening. And so this backbone organization does a lot of things, but one of the key things they do is they bring people together and they work to make sure that values are aligned across the collective, and in particular that there are sharing activities, all these various different things. Some examples of the leadership and success that was won out of the advocacy and work of Taibu in relation to others was the collection of and dissemination of race-based data, especially as it was documenting the inequalities and uneven experiences of mortality, really, in terms of COVID. And as a health center, they're sort of inside outside in terms of being part of the state, part of the government, but also spanning this kind of advocacy role at different times. And so Taibu provides us with that example of how to work on that straddling of the inside and the outside, often working in partnership or in networks with others. Another much smaller organization and much newer organization that we've looked at is called Uzima Women International Relief. They're a relatively small local charity, also in the northeast of Toronto, but they work on global issues. So they have this sort of local, global focus that is centered on food security, income support, and gender-based violence. They collaborate with many different people and change makers across different. Oh, did you change it? Sorry. Yeah. Sorry. Thank you. I was trying to figure out what this acted in front of me was. They collaborate with many different folks, and this is one of those cases where we see the leadership of Taibu really shining through, in that Uzima has its own focus, its own identity, but has learned a lot from Taibu's history and gained a lot from their leadership. So some clear outcomes of the work that they've done is increase vaccine rates, improve food security, especially among seniors and youth, and strengthen relationships with community organizations and new partnerships. That one, I think. And then the last key case study we'll present today, is the Back Farmers and Food Growers Collective. They're located in the northwest of the city, so quite a bit of a distance geographically from Uzima and Taibu, but serving the same focus of populations, but very differently situated in terms of their orientation to the state and or in terms of their political framing. So they have a healthy distrust because of a long history of working along Black sovereignty and Black food sovereignty in particular of the state and of formal organizations. And so they rely on trusted intermediaries to figure out how to broker those relationships. They're willing to engage with like-minded groups, but there's a trust. You have to establish trust to be able to work with them. During the pandemic, they delivered 5,000 food hampers to residents. They engaged in an ongoing struggle for legitimacy and support for thinking through what Black food sovereignty might look like in Toronto. And then in 1 minute to talk about commonalities. All of our case studies center Black, African, Caribbean people, but also epistemologies or knowledges at the center of how they do their work, and that shapes their theories of change and their values. They're concerned about societal transformation, anti-oppression, and anti-Black racism, and these, again, also frame how they do their work. They take on a social determinants of health understanding. So food and health justice are not distinguishable as separate buckets, but rather are intersectional and interrelated, and you can't talk about one without talking about the other. They also have processes that are unique to each case about accountability in terms of their own communities and who they work with. And they leverage formal and informal partnerships with the state or with intermediaries or with other organizations to do this work. So I'll leave it there. Happy to answer any questions when we get to that.
Next, we will have speaking on the experience of Brazil.
Okay, hello. I'll try to bring some reflections from a public policy perspective, public policies that can help to tackle persistent inequalities. We all know that there's a long debate about top-down and bottom-up approaches to public policy, and a long fight for the need to decentralize and work closer to communities. And the whole idea is that communities better understand local needs, local realities. There is some kind of local knowledge that is a component, an important component of social innovations, which are responsive to the needs of vulnerable communities. So this is a rationale that we have been learning and studying and fighting since ever. But there are other perspectives, and I will bring one that I think will not be very welcome in this room, but I think will help us to think about. Now, Steve Jobs has a famous phrase where he said, "People don't know what they want until you show it to them." And as a digital user, we will find that this is true. They can answer me what I need, I don't know. But when the solutions appear, I can use them and think they are very good. So, and yesterday we had a lot of discussions about what is local knowledge? You know, where do we put the boundaries? Frontline workers are community, are the system. How do we deal with this kind of thinking and boundaries? And how local knowledge relates to social innovation. So there is an ongoing thinking that there is a specific knowledge that is related to social innovation that is different from specialized knowledge. And we are inviting you to think about this and how to bring social innovations and public policies closer. So these are some of the questions that motivated us through the research process. I didn't change it. So as a finding, you know, an important finding of the project in São Paulo, about local knowledge. Something that we learned was that communities had a very clear sense of what were the ordered needs at the community level. Let me explain this. In the media, in the press, in the beginning of the pandemic, we only heard about the sanitary and the political crisis that Brazil was experiencing. But the communities were very quick. They perceived that hunger and food insecurity was a problem, and they started to work to support communities in fighting hunger. So this was something important. And the second point is that we studied 4 initiatives. And all these initiatives really found different ways to respond to the food security crisis. So not all of you were here yesterday, but we presented the cases. And I want to highlight here that the 4 cases found different ways, different logistics to distribute food, and also features that were more appropriate to these communities. And for example, Sanremo, that is one slum near the University of São Paulo, they could map all the territory, and they were really worrying about distributing 100% of baskets for all the population. So a kind of universal initiative. Then we have another initiative that is the House of the People, Casa do Povo, that is in a region where we have a lot of immigrants. And then they thought, well, instead of offering closed food baskets where people will have things that they don't eat, let's open the baskets. And they organize a kind of supermarket. They open the baskets and people could go in and choose. So this was different from what Sanremo did. And the Solidarity Kitchen that Juliana is talking here a lot about it, they also felt that, wow, there's a crisis, there's a gas crisis, people don't have money to buy gas. So it's important to prepare the food. So they began to distribute a cooked meal for people. So this kind of initiatives and creative solutions, and not only the solutions are creative, but they also found ways to distribute the food that were very local. The way they organize the networks, the way they bring people on board to receive the food. So creative solutions, logistics were implemented, healthy food, universal coverage, choice. So this also brings some values of the organizations. So lessons. First, local organizations reacted very quickly, identified needs, and defined partnerships and new ways of delivering services. And this, for us, was something very clear in the case studies, including logistics about how to reach those more in need. And some of the conditions that we expect that should be there for this initiatives were there. We expected to have previous mobilization. Okay, all the cases worked with organizations that already existed. We found public and private resources coming in. This is all cases. And some degree of institutionalization. So some of the experiences are becoming more institutionalized as Solidarity Kitchens and as the Quilombo Periférico, that is a collective mandate. But some conditions were more unexpected for us. The first one was that organizations were very quick to act. The responsibility to changing conditions, quick reaction and learning. They all did this. And then when we went to the organizations to speak with them, to know more about their history, it was clear that all of them are always struggling to survive, and they change very quickly. So what happened during COVID is something that they are very used to. And this is something very different from public policies, that changed in a much more different way. So new sources of private funding, growing philanthropy. In São Paulo, clearly, the philanthropy is growing, and all these organizations are learning how to work with public money, but also with philanthropy. And they have different norms about how to use private money. And the role of organizations' values in framing the innovations. So innovations are different because the communities are different, but also their values are different. Okay. So looking at these experiences, what the next steps? No? What can we learn about how doing public policies a little bit differently? So learning how to work together with local organizations to deliver social policies more effectively and better tailored to community specificities. You know? So this is something important. You know? All these cases were better tailored. And how to bring local knowledge and social innovations closer to public policies. The how question that is where I think we need to think more in the next days. First, strangely civic infrastructure, you know? Funding, networks, and something that we didn't discuss here is accountability. You know? We are saying during COVID, the 150 rules that in normal times, you have to go with this 150 rules to get the money. They were not there. It was much quicker. Okay, but in normal times, you need some kind of accountability. And this is something that we don't know very well how to do. Next is what Liebe brought yesterday about working with a system approach. You know, it's not only about working with the community. It's how to bring also communities in, you know, and it's not necessarily institutionalization. You know, it's something a bit different. That is to bring this knowledge in closer to the bureaucracy, closer to the policies. It's not very easy to see how this will work, but it seems a good idea. You know, and it's something different from what we saw in the 80s and 90s about NGOs. You know? So we delivered service for NGOs, we asked them to make the job and we paid them. I think that we need to count in communities in a bit different way. So what is this different way? So that's it. Thank you.
Thank you, Bernard. Lots of food for thought there, I think, for us to think about in this session. Next, I'd like to introduce Professor Lauren Andrews, who will be joining us from. Have we got the wall?
Good.
Good afternoon, Lauren. Welcome.
Good afternoon, everyone. Can you hear me?
Thank you.
Can I just check how we're going to do for the slides? Do you want me to share or?
What would you prefer to share yours so that you can?
Yeah, I think it may be easier if I just share my slides, if it's fine.
Super.
Oh, but I can't. I think I just need to be authorized to share.
Sure. Does Professor Lauren just represent it, right?
Otherwise, I just say next. I'm just
Yeah, you're all so you should be able to share your screen.
Okay. Yeah, now it's working. Can you see it?
Yes, perfect.
Okay. So thank you very much again, Jenny and Alex, for the invitation. So as Jenny mentioned, I'm going to present along with my colleague, Luciana Bisotto from the University of Sao Paulo. But I also want to acknowledge my colleagues in the room in Birmingham. Interestingly enough, we're talking about the pandemic and I'm stuck at home with what looks like the latest variant actually of COVID. So my team is there in Birmingham face-to-face working on our project and I'm just stuck at home. So in the room, just to acknowledge, I have Lochner Murray and Abraham Manta from the University of the Free State in South Africa. I have Susan Bonner, Peter Craffle and Christiana Zara from the University of Birmingham. And I also have Leandro Gatti and Leonardo Musumeci from the University of Sao Paulo. So my colleagues are in the room and will be here really to answer questions and also to ask questions during our time for discussion. I'm going to start and present the first few slides, and then we'll zoom at some point on the Brazilian case study, and I will hand over to Luciana. So as Alex mentioned, our project is focusing on young people, but does have a very similar focus to your project in the sense that we are looking at food, but we are also looking at education and play and leisure. And really what we're doing with this project is we are aiming to understand the impact of the pandemic on a specific age group, young people. And we are here working on an age group between 10 and 24 years old. So different age group, different generations in terms of life trajectories. But we are much more, we are really interested in young people living in deprived settings. In other words, really dealing with everyday poverty. And for our three countries, we're really sort of focusing more on sort of specific cities and specific regions. So Sao Paulo, Central area in South Africa, and also the West Midland, Birmingham in England. And as mentioned before, within this idea of looking at specific services that young people have access to, and for which essentially they are supposed to have key rights, we are looking at it through the scope of looking at the nexus. So we were looking at the interconnections between educations, between food, play, leisure, and we're looking essentially at how, in the way they've tried to access those key services during the pandemic, what kind of adaptations, what kind of actions emerged out of this, and how this impacted positively or negatively their resilience and really their ability to cope and to move forward. The key thing and the key strength of our project is our co-design, our participatory methodology. So we've been working in different stages. One of the stage was to work and to interview key stakeholders, but a key part of our work has been to work with young people directly. So we use party methods from working on visual mapping, but also doing short interviews and also working in groups with young people, in some cases becoming also local researchers. And in our three countries, really, we work with them for the past year, trying really to understand their lives during the pandemic in relation, again, to how they were able to access food, how they could have leisures, and also how their education overall has been affected. And you can see here how we've been doing this in our three countries. So really just to get a very quick overview of what we've been flagging up, analyzing, and really saying in relation to the impact of the pandemic on young people, what is quite clear from our perspective is the fact that when you're looking specifically at vulnerable young people, the pandemic, but also the national government responses in terms of closing schools, in terms of not thinking initially of about children who have access to food through school, but also the policies related to the pandemic, and especially in South Africa and in England, lockdowns. All this has directly affected children and young people. And especially what it has done, it has increased social economic inequalities. And it really put young people in very challenging situations and in a sort of ongoing context of crisis. And what is important here is really to acknowledge that the pandemic was a crisis, but it was a crisis built around other path dependence disruptions, existing vulnerabilities, existing crises, and then further crises, and what we call, for example, in England, the cost of living crisis. And in relation to this, what is really clear from our project is how the pandemic had dramatic effect on education, with school being closed, with children and young people not being able to pursue and to continue their education. Their access to food was impacted in relation really to a healthy diet, especially, but the type of food that were going to be used and found. And also on play and leisure, the ability really to socialize and to be with others. Interestingly enough, health is not part of our nexus per se, but the consequences on health and especially on mental health have been very clear throughout our research. And really what is clear as well here is this accumulation of crisis has had enormous implication on the life of young people, not only during the pandemic, but really in the term of life trajectories, and their ability really to be able to decide what they want to do next, and how some essentially just saw their life trajectory completely really turned about because of what happened during the pandemic. And the key issue really is how children and young people overall were just completely ignored, not heard, not really taken into consideration during the pandemic, because really they were not perceived as at risk. They were not really as vulnerable in terms of having COVID, dying from COVID. And as a result, essentially, the impact of the pandemic on them wasn't really considered as a top priority. There were in all 3 countries and across the globe targeting policies for young people, typically looking at schools, but overall, really, they didn't manage to counterbalance the impact of the pandemic. And as a result, really, it led to a lot of different organizations, local groups, communities to step in order really to support children and young people and to allow them to cope. So what we're seeing all through, and I think that's really important to flag this up in relation to giving the voice back to young people, is to demonstrate and to highlight what they felt during the pandemic. And I've put here a couple of examples of what children and young people in England and in South Africa, for example, told us about feeling like in a prison. It wasn't nice. It was impacting their mental health, impacted really their social life, and essentially their freedom was just taken away, their freedom just by moving around, but also just being able to talk and to say what they wanted. And in addition to this, really what was a real problem for them is the perception the politicians had against them. I think they felt they were very ostracized. They felt that they were just blamed and they were the ones that were targeted. And I think that's really important. It's very much taken to very next level when we're looking at what happened in South Africa, noting that a lot of young people, for example, were just bitten by the police because they were getting out and they were trying to find ways around the restrictions. So overall, coming out of it, and just really to flag up what our research has been highlighting, I just want to go through a set of key results. So the key thing, obviously, what we saw is out of our project, adaptation have been very local because the national responses and even the regional responses were not enough. So the state as a whole didn't manage really to provide. Some representative of the state at local level managed to support, but a lot of the support came through more ad hoc responses, either families, communities, social workers, police in some cases, actually, as in England, who really step in to provide support and to help in relation to what was happening. The other thing which was clear here is also how other groups like community groups, religious groups really step in. And we can really see this when we're looking at the South African case in that respect. And all these organizations really allowed to build and to develop this resilience. And we're talking here about organizations like Adventure Playgrounds, for example, in England, but also Food Bank, who step in order really to respond to the digital divides, to issues around home, the nature of home, the ability for families to find food, and all those kind of issues. And the key thing as well out of this was very much war effort that emerged out of the pandemic, and how a group of individuals and group of actors and agents really got together in order really to support young people further. And what is interesting as well is we tend to see, for example, the use of social media as an issue, but there was essentially a lot of support that happened through informal network, through really networks that rely essentially on using the media, using other forms of communication. And this allowed, as in Brazil, for example, communities really to cope. And I would just like to finish before handing over to Luciana, really to mention that also what is clear is how young people, as a mode of coping, the way they do it was actually just to break the rules and to break the boundaries in order very much to escape from those prisons that were created essentially for them in a time of crisis. And this is really where our research matters, and this idea of working with young people and trying to make them understand what happened during the pandemic and how they cope. And we just want to highlight this very quickly by just demonstrating what we did in Brazil. Luciana?
Hi everyone. We wanted to share this slide where you can see two of the visual webs that were made by the young people from participating in the Brazilian part of the research. Well, by using photographs, drawings, and texts, those visual webs, they are an attempt to represent a little of the diversity of languages and materialities that young people relied on to express their experience of the pandemic. On the left side, there is a visual web from a 14-year-old girl who lives in Paraisópolis in São Paulo, and who during the pandemic was able to observe from her window many local actions to combat hunger and fight COVID in this favela, and experiencing also the possibility and the strength, the possibility of local action and the strength of this community during the context of crisis. And on the right side, there is the visual web from an 11-year-old girl as well, from Heliópolis, another favela in the city of São Paulo, who uses here the image of the virus that we saw in many children's drawings during this period to represent somehow a flower, which is a mix also of the emojis figures that we use in social media, that we are used to see in social media. And she represents them here with a barrier in the middle, which means the before and after COVID, and somehow bringing up a series of pictures as the root of this and leaves of these flowers to share the ambivalent feelings of joy and sadness during this experience. You can pass the slides, Lauren, or whoever is. Well, the visual webs, they were a successful strategy for us to allow young people to share not only information about their experiences, but also feelings. And as they shared themselves, joining the research was somehow a collective way of healing during this process after the pandemic, as they have shared. And since they didn't have the opportunity before to discuss what happened, and society was constantly telling them to move on because the pandemic was over, so they all shared the importance of joining the research and have this time to share what they were feeling and their experiences. And in this encounter, as we can see in the picture, which are they were also encounters where we shared food while we were talking, which is something very cultural also in Brazil. Young people also shared the perception that education was the most impactful dimension in their lives during the pandemic, considering the closure of schools and the subsequent failure of the government in the remote learning model that was adopted, which somehow deepened the inequality and the vulnerable situation they are in. Next. So they also shared this impact in a very clear way around the mental health issues, which at first was not a central topic in the research, but emerged as a denunciation from several young people. They connect this situation with the feelings of invisibility in the face of the political decisions, and also about the intense use of social media during this social isolation period in their lives, affecting, which we see now how much affects Brazilian young people's perception, self-image, and generating insecurities and leading to anxiety behaviors. These are some images of the young people who participate in the research in Brazil. And I will now the floor to Lauren to share some conclusions. Thank you.
Thank you, Luciana. And very quickly, I think really, I mean, what we want to highlight here is how those adaptations that really young people developed with each other, but also with other communities. I mean, how this was very much embedded into dealing with the immediate, but also longer term impact of the COVID lockdowns, but also the path-dependent really impact of the existing inequalities. And what we're seeing here is really the importance really within those adaptations of the existing and the new connections that really were sort of fostered during the pandemic, creating resilience, creating new forms of coping. And here clearly, I mean, the the new forms of learning, sharing, expressing views and needs became very much the drivers in order for children and young people really to be able really to continue their life forward. And the final point really on this is just really to reiterate that overall, there's a key political issue and key political problem in regard to how we're looking at this issue really of children and young people, adaptations and resilience in time of crisis, because not only their voices were not heard really during the pandemic, but there's a wider impact nowadays in relation really to trust in regard to the wider system and to who really can be there for them. And in relation to this really issues around power, empowerment, disempowerment, and overall discontent in relation to what's happening in the society as a whole. Thank you very much.
Thank you very much, Laura, Christiana, Luciana, and colleagues. That was a fascinating presentation with some really important insights there. I will pass over to Fabio Swans, who will bring some of these bring together these amazing presentations with some of his reflections, and then we can open the floor to some discussion and questions. Thank you.
Thank you, Jennifer. Oh, it's working. Just thanks for inviting me to this session, for allowing me to work so much about all these local experiences, including from my own country. That was, I wouldn't say I'm completely ignorant, but I didn't have much knowledge and detail about them. My reflection here will mostly go along the lines on how, taking the last question from Vera's presentation, so how to work with the system. So from a public policy viewpoints and the relationship with the several different organizations that we had with different degrees and different nature, different degree of relationship with the system, meaning local governments or the governments at large, but also the other institutions and actually the mission that they have for themselves. So we saw that as among the difference here, we had this strong difference regarding the nature of the organization that we're putting forward response to the COVID-19, response to the lack of service, particularly on the food security side and on the health side during the crisis. I mean, as a researcher that does applied work and tries to inform the public policy, the first thing that comes to my mind is actually a challenge that I'm seeing now in the work I've been doing, as I mentioned yesterday when I introduced myself around the task force against hunger and poverty. It comes from this the discourse that's quite strong that we need to have evidence-based policy making. Then one of the things that I fear that's missing in many of the projects is actually to document impacts or to document evidence of impacts that would make it easier for policymakers, particularly policymakers, policy implementers at the ground level to take it up if the system allows for that, or to make it stronger the advocacy that the different movements or the different organizations make to convince government at large to implement the policies. That on one side. So depending on whether it's the willingness of the movement, it is the objective of the movement to scale up that initiative through the government channel. So how we can build it, and I see the issue of the evidence as a big barrier that needs to be overcome. So which type of partnerships social movements would need to make in order to provide this evidence and convince government, academia could help on that, which type of alliance you could have around this. This is one route when you want to institutionalize, as we have been discussing here. But the other issue, and it goes to a different track, is if you don't want to institutionalize because you see a risk that the social organization or the social movement can be caught or can change its own nature and its own mission. So at the local level, people may start mistrusting the movement because the movement becomes an ally of the system. So how you can navigate these two different waters and how the different case studies that you saw here can help some reflection around these issues. And for that, for example, we can see when the governments rely on the community to do the mapping of vulnerabilities, mapping of the households. So that's something, some sort of social technology that we had seen in many developing countries. We had seen Brazil with what they call the busca ativa, the active search for potential beneficiaries, and allowing social movements, grassroots organizations to actually have this access or to contribute to the registration of potential beneficiaries of social policies. So I wonder whether this is going to be the social movements become the new NGOs, and whether they are paid, whether they have free labor, and how these can be thought about or can be institutionalized. Finally, some like more detailed comments that I would have, specifically the case of Brighton in Alex's presentation. I was a little bit like under the assumption that digitalization is colorblind, so it would be good. And it's interesting, in the last presentation, we saw different views on a positive view of social media, and it was like a cool space in which the youth could interact. But at the same time, because it's never good and bad, it's at the same time some space that would actually play with the fragility and increase the fragility and self-esteem of the youth. So just to digitalization perhaps is a good thing that we look at, because actually it's much more negative, at least in the discourse and the fear that people have in order to regulate digital means and the potential for social exclusion. And we saw that in many of the case, particularly in Brazil, for example, to register for the emergency benefit, we had this concern that people wouldn't be able to register in the app. Yeah, I think I'll stop here. Thank you.
Thank you very much for those reflections. I think that sets the stage for us to take a round of questions, either to the speakers who were presenting earlier, and including to our colleagues online. And do we have them? Oh, and Zoe has, are you happy to row? Wonderful, thank you. Because we're very little food now.
Yeah, sorry, I'm rushing because I have to leave because, hi everyone, I'm Maddie. I work for Save the Children International, and I'm also a partner of the very local food hubs in Pevendine and Moscow and Beta State. And I have two questions related to this. And I believe, because my team at Save the Children International are going to discuss this afternoon, how we become more locally led or give more power back to local and national actors. And so my question, I mean, I was thinking mostly about the Panex-Youth, but in general, how can international NGOs help and be a part of this, a part of communities' work, and then support that work? So I think that felt like a missing piece, and I'd like to hear about that. And then the second was, I guess I'm struggling, especially now that we're in this election frenzy everywhere in the world, how policies and institutionalization links to sustainability of a local organization. I think we were talking about it in the food group earlier today, about how we were saying that getting a policy or something in the books to support your local organization makes it sustainable. But we know that with ongoing elections, things change very quickly. And so I wonder if you could speak a little bit more to that. So partners and policies.
Wonderful, thank you for that, Maggie. I should have added, we have an incredible richness of experience and expertise in the room with colleagues who are involved across Canada and Brazil, and of course Brighton and Hove. So please, if anyone would like to jump in to answer some of the questions coming up from the floor, please do. Maybe that was to the colleagues in Birmingham, am I right?
Yes, but anyone's welcome.
Wonderful. So please, colleagues in Birmingham, if you would like to speak to Maddie's question, that would be great. Can you hear it? I'll just send a message. And if we have any other questions or comments in the meantime.
Can you jump in with this question? So on your first question, I think for me, it's often about capacity building, local capacity building. And it's a shift in mindset from wanting to be an expert versus wanting to build expertise in the community and to extend the processes of decision making, the processes of leadership, the processes of agenda setting to the communities with whom you are working rather than for whom you are working. So I think once you set that your framework into a capacity building framework rather than a leadership framework, then it opens up all kinds of possibilities to think of how the local might be involved more readily in everything from agenda setting to actual provision of programming.
And just as we wait for
Sure, thank you very much. Yeah, great questions, Maddie. I mean, I think as you'll be aware, having studied ideas as an institute that works in the field of international development, we are trying to engage very seriously with debates around decolonization and decoloniality. And I think we also have a principle guiding our work with many countries around the world, including Brazil, which we call mutual learning, which is an approach that we took from our Chinese colleagues. So that's to say that we have a grounding in international development that already problematizes North-South hierarchies, and we are bringing that home and asking questions about how to decolonize relations in our home city. And that is not coincidental because a lot of people involved in this work have a background in international development. Some of our city council colleagues used to work in international development. We have, is Mike still with us? One of our advisory group members learned his trade in Zimbabwe and then became very influential in the local health system as well as the community organizing. So I think this process of learning in the south and bringing it to the north has been incredibly important to us, and it's something that we've tried to embody in the project. But it's also kind of pragmatic realization that if you're trying to lead, you're not listening, you're not learning, and that the learning needs to come from people who are in positions of marginalization or racialized marginalization, whether they're in the north or the south, and that it's their voices and their knowledges that we all need to be learning from and building on. Thank you.
Thank you, Alex. Industry.
Thank you. I'm really like on this to put my two pence worth in, because often I think it's about trust. And local organisations who are often not trusted. And we went through a process recently with another Black-led organisation, and the amount of scrutiny was shocking. It started with, we don't know who you are, I've never heard of you guys before. That's where it started, the conversation, which was devastating. And so I think it's about letting go of power, and I think, David, you captured it very well as you did, Alex. And it's about letting go of that power, and I think it seems to be I don't think it's just around Black-led organisations. I'm reading Rory Stewart's book at the moment, and it's really interesting about international development and lack of trust. And I think you see also in councils where they bring in some fancy managing, consultancies who tell you exactly what all the staff are very well aware of. So it's about trusting the people who are actually doing the work.
Yes, Stephen, and then Katie, and then we also have our colleagues in Birmingham already.
I was going to ask a question, but then the question led to a comment I was going to make, and I think it refers to the quotation that Vera put out there to instigate us, I think. But I was thinking about it, and thank you for sharing because it creates thoughts in us. But I was going to read it in this way. it said people don't know what they want until you show it to them. But I was going to say people in the system don't know what they need to do until you show it to them. And we had this conversation yesterday as well, because I think that transformational relationship is, I think, where things can move. We know the system has power, the system has the money, the system has the access, but the knowledge, the readiness to respond, from your example in Sao Paulo, is in the community, and I think that's where the transformation needs to happen in order to make sure that the system is taking what the community is giving, and the community is taking away the decision making and some of the resources to be able to respond to communities quite quickly. And again, around representation, maybe a question as people who presented from Birmingham can also respond to that, is in terms of the research they did with the young people, how many young people were also involved in the planning and execution of the research as well, because that's where we can see those transformative actions taking place.
Yeah, mine was more, I suppose, a comment really, and in Mystery's words prompted me to say it, as well, I think as everyone was speaking, I sort of felt like I was jotting down and kept coming back to, is that trust is completely key. And working in local government in Brighton and Hove through the pandemic, working on food, working on health, living, breathing, public health, data and evidence-based, but not just in isolation, how it applied to our local population was absolutely at the root of what we were doing, and constantly communicating, through press releases, through interviews, but through Q&A sessions with communities. I think trust is an absolute factor in there. Probably cuts across all of the different conversations. So, and that's the only way it can work, I think, properly. And although we're in a time when none of us are meant to be really talking about politics, I think that is also part of the dynamic that meant that some things worked better at a sort of city and local level when they weren't working as effectively following national voices.
Thank you for that. And for colleagues who are online, that was Katie from Public Health in Brighton. And we have Luciana, are you able to join? I know you're now back on.
Yes, no, just about the first question about the international organization's role in the local level. I would like to share a bit about the experience from Brazil, because we mostly were connected in the research with local organizations and not that much with international organizations. But we know how important it is for the local organizations to somehow be connected with those international ones, mostly because of having access to resources, because during the pandemic, many of the local actions that were happening back then, they couldn't sustain in time because of the lack of resources, and also because of the overload of work for many voluntary work in those communities. So for sure, this connection of local and international organizations, considering the possibility of funding in the local level, is important. And I would like to give the example of the community of Heliópolis, which we work, because we work there with a very special group of young people who work in the observatory De Olho na Quebrada, which is a group funded. It is a group that is part of the neighborhood organization in Heliópolis, which is an organization that came from the movement in struggle for housing rights in Heliópolis, which is the largest favela in São Paulo, that was born in the 80s. And this movement today, which is a very big and organized movement, which is UNAS, Heliópolis and region, it has this little group of young people who are researchers about the community, and they research data about the community, acknowledging the invisibility of data around the community issues. And this group is fun. These young people, they receive scholarships, grants that are financed by international organizations. So I think it's a great example of how international organizations can somehow work at the local level together with strong communities that have a history of mobilization in the territory, and that is connected, considering this intergenerational aspect, it is somehow connected with the formation of people in the territory to keep the struggle on during time. So this, I think it's a great example to look at, and also to share that they also face challenges. I mean, the last time we were with those young people, because of some bureaucratic issues of the international organizations, the grants that those young people receive was threatened, that they wouldn't receive the grant in the next period because there was some documents they didn't present it, like lists of participation in some events, something very bureaucratic that threatened the income that helps them to sustain their research, their lives, and sometimes their families. So I don't know, just sharing some thoughts around the experience that we had.
Yeah, thank you so much for that, Luciana. That's really insightful. I see we also have a hand from Professor Suzanne Sika, who is the co-investigator leading the work in Toronto, and unfortunately couldn't be here with us today. Suzanne, are you still there?
Other people. It was a question to us. I'm sorry.
We couldn't hear.
I was just saying we have. Right. Can people online ask questions? Thank you.
If we want Suzanne to speak, we have to make her a presenter so she can take her.
Okay, sorry, Suzanne. Can you now?
Hello, sorry. Can you hear me?
Yes.
Yes, perfectly.
I just want to pick up a little bit on the discussion of trust, because I'm wondering if it's a bit more nuanced, such that we don't necessarily, I mean, ideally in a great world and in a wonderful, all things align, everyone trusts each other in the state or private sector or whatever it happens to be. But in my, I think, and this comes from the reflections of our entire team. So this is not just me, but it's like my interpretation of team discussions of Taibu's role, for example, during the pandemic and before and ongoing. I think that perhaps it isn't necessarily essential for all of the people that they brought to the table, all of the groups, etc., to trust in the state or whomever, the big pharma, whatever. Maybe what matters is that they trust Taibu, and that Taibu is sufficiently sophisticated. It has enough, I mean, I don't know what it has. It's like fairy dust. It's magical. But it's also Afrocentric. It's grounded in a very different worldview and practice. But all of these things, Taibu is close to the community. It's trusted by the community and its partners. Not everyone, not universally, I mean, always work there. But what we saw is that they were able to use this role of trusted intermediary to really, as David pointed to earlier in the presentation, navigate different levels of government, different actors, bring people to the table. Those folks may not have all universally trusted Health Canada or Big Pharma, but they trusted Taibu, and Taibu could navigate and advocate and did so in a way that really called people in, held other people accountable, and promoted, really anti-oppression and equity and justice in governance and relation, in being in good relations. So I wonder if the trust issue is absolutely for sure, but at the same time, who is needed to be who do people need to trust? And maybe, I think the question came from a representative of an NGO in the room. I'm sorry, I can't see, but maybe in your role as NGO in the changing kind of political climates that come and go with different leaders, maybe your role is to be close to community, to hear them, to engage, to create space, to think about redistribution of resource, and I don't know, manage up, navigate the rest, so that trust is built at that level. And wonderful if the trust comes in the big institutions, but the big institutions, the state, etc., we can't pretend they are, we have to see them for what they are, and they are deeply colonial, and they are grounded in whiteness and all kinds of other privilege. So I don't know, that's just my a little bit of thinking about trust. I don't know that it makes sense, but I think there's more there.
Absolutely, thank you, Suzanne. Yeah, I think there's a rich theme that's been one of the things that's really come up time and time again over the course of the last couple of days. I'm Lydia, Lydia, I believe you had a
Yes.
question.
Can folks hear me? I have to use the mic. Yeah, I thank you so much. I was sitting here wondering if I should say anything because lots was being said, but I want to pick up on something David said, and a number of people have mentioned it in different ways. Decolonizing. One of the I think the founding went through the COVID practice, and one of the things that I was responsible for was creating an equity plan for the city of Toronto around COVID. What I used was an indigenized approach. And an indigenized approach means that, two things: targeted universalism, which is ensuring that we target those who are most marginalized, so the goal can be met universally. And secondly, an indigenized approach, which says you must have relationship with the people you're trying to serve. So we looked at people, accessibility, youth, Black, Indigenous, and racialized groups. There were 5 groups that we targeted. We created tables for each of these groups that were created by and for the tables. Those tables, so people with accessibility issues, because we know they were tremendously impacted through COVID. And then, of course, we had to look at intersectionality. But the key was to build relationship with each of these groups and let those groups tell us what they needed. And because Suzanne is absolutely right, and everybody's right, people who are marginalized don't trust institutions. That's the truth. And so we have to face that. Nobody trusts you, nobody trusts me, but they trust each other. And so the key is to build the tables with those people and let those people inform what happens. Thank you.
Thank you very much for that, Adriana. I can see that there is Christian online wanted to comment on the role of youth, young people's participation in the research. Christian, are you still with us? Oh, sorry, I couldn't see you there. Great. Christian, if you wanted to take a minute to reply, you might still be on mute.
Unmuted. No, we did. Okay, thanks. Yes, there was this question about the level of participation of young people in the research that we are happy to we're happy to answer. Well, firstly, the whole research was informed by a participatory methodological approach, which took various nuances in the different case studies, countries. There were different levels of involvement of young people in the research. On a methodological level, we asked them to participate in a series of activities. So it wasn't just a one-off activities. So that was they were asked to take part in a in-depth interview, leading then to a more creative exercise based on visual activities, which involved the young people more deeply into the process of co-constructing the data and the information. There's also, especially in the UK, but happy for colleagues to comment more on Brazil and South Africa. In the UK, we've been working together with a youth group, which is part of the Birmingham Youth City Board, and they researched with us. We trained them in qualitative methodologies, and they effectively become co-researchers with us, helping us to collect interviews with their peers, and also working on all sorts of different ways of interacting with the research, also on delivering the outputs, constructing in a more youth-friendly way. And we are now at the stage where we are progressing to another step of the project, another work package, where we're working out a way of bringing the young people from the different countries together to discuss some of the findings that we've been that are being emerging from the project, and to also to co-analyze some of the preliminary findings. In the UK, we had a local cafe where we had the young people co-analyzing with us the preliminary finding and advising on recommendations, and we're looking at bringing these to an international level, where different groups of young people who participated in the research will be able to share ideas and recommendations and further co-analysis on the data. So I hope this answers the question.
Thank you for that, Christian. I think as we started late, which is why we're finishing a little bit late, but I wonder, Ivana, maybe you could speak to the point that Fabi was making. It's something that's been in the background of the conversation, of this idea of digital, digital being or not being, in this case, colorblind. I feel that's something that digital being colorblind. Oh, I lost my microphone. Colorblind.
In the end of the morning session on health, Jerry spoke that we didn't speak enough about digital innovations and how this could change the game. I think in health, we are elaborating this in some way, right? But much more from the system side, what you can offer, how this can really arrive to communities and bring citizens that live in remote areas closer to the system, and also build capacity of the professionals. I don't know exactly how this works in the food sector. I would like to better understand. But from my point of view, it can be a democratic tool. Yeah, a democratizing tool. But for now, there is a real risk that all this will evolve much more in the private sector than in public policies.
It's just a comment, and this is my own personal antenna. When the word colorblind is mentioned, it's very edgy.
Yeah, I think it's an interesting topic.
Yeah, because I think if somebody says I'm colorblind, or if a system is colorblind, that means I'm afraid I'm not seeing. And so I just wanted to comment on that, making sure that we understand what we mean by digitization and colorblindness. But also my personal reflection on digitization and AI is going on right now. I'm not there yet, but making sure, because AI is, behind AI, there's always a human system that is creating this platform, and whether, and what is that lens that is being brought into digitization and AI to make sure that, particularly for the work that we have done, and in this particular work around pandemic response, crisis response, there's been a lot of work that has gone in, that has come out positively for Black, Indigenous, and racialized population, because they became visible, maybe not by design, but you know, and there's been some great work being done, understanding what people are going through, understanding that these are generational inequities that existed before COVID, and now we have an opportunity to address some of these disparities and inequities. And so when we bring in different systems into the space, that we make sure that that lens is still very focused on those people who are most impacted, understanding that anti-Black racism and indigenous racism and colonization, all those kind of things are the foundational work where transformation needs to happen.
Do we have any more thoughts, comments, or questions from the floor before we move towards wrapping up? Or from indeed among the speakers? Thank you. So thank you very much, everyone, for staying with us, both here and online, and to our colleagues in Berlin for joining. And I should say for the heroic and sterling effort of Lauren Andrews joining when she had COVID. I think she's left to rest now, rightly. And I'll take just a few seconds to reflect. One of the things that keeps coming up is this question of trust and how we work together. And I'm reminded of one of the people who was interviewed for this project here in Brighton and Hove, Ian Chambers of the Brighton Food Factory, wrote about moving at the speed of trust during the pandemic. And this idea of how it was that trust that enabled the speedy response and the action, and for people to come together in ways that previously would perhaps have been unimaginable or only imaginable but didn't actually happen in practice. And we see this across the 3 or 4 more contexts that were described today. Also, this idea of, you know, sometimes as academics we split things up into buckets because that enables us to talk about them, but the inextricable links between food justice, health justice, voice, representation, how different marginalized groups, we've heard about youth and children today, how they participate. These things are intertwined in such important ways, and whilst we can pick those strands apart to examine them more closely, we must then look at them when they're all joined up back together again. There was also some, you know, there was some reflections on kind of different levels of trauma or the need to, you know, build resilience and respond. And again, I'm reminded of another person who was interviewed who said, you know, we're very resilient, we marginalized groups, but you know what, we're tired of being resilient. Actually, we're tired of being resilient, and we would like, you know, a different response and a different kind of engagement between our communities, organizations, and the state. So that's something to build on. And last but not least, you know, Fabio was pointing out the need for an evidence-based impact, but also the perils of how that functions in terms of organizations who may or may not want to relate to the state in those particular ways. And I think I, for one, personally take real hope from the fact that we've seen a tremendous evidence base showing a tremendous amount of impact in ways that are hyper-localized, but also which connect to the state or to policy at the city level. And so there are ways of doing things differently that work, and we need to build on those. So thank you very much, everyone, for joining us today.